Yes, good morning, everybody. Okay, we want to run into how you can actually identify that your husband is having fertility issues. I'll be speaking on the female part of it later. Okay, if your husband is actually having fertility issues, this is how you will know. If your potential man, husband, actually want to know if you're actually okay. All right, there are some signs and symptoms you can actually use in identifying it, which one includes the low sperm count. If a man is having watery sperm or having some count that is low, it means that fertility issues is awaiting this very guy. Do you get it? If the man is having abnormal issues with erectile function, abnormal issue with erectile ability, it means that this man is having fertility issue as well, because it will affect a lot of things in his system, and achieving or maintaining erection can affect the person's fertility. All right, abnormal aspect of sperm motility. If a man is having issues with his motility, the percentage of his motility, if it's reducing, it can actually induce infertility as well. Okay, when you're having undescended testes, when one of the testes of a man is not actually at a particular position with the other one, whether left or right, it can actually be an indication that this man is having fertility issue, or he's going to run into fertility issues as well. When you're having pain or swelling in the testes as well, it indicates that you're having an underlying issues that indicate infertility as well. We have difficulty in urinating issues, or difficulty in urinating per se. It means that you are having issues with urination that can be related to fertility problems as well. All right, it could be prostate. If you're having issues with your prostate as well, it can indicate fertility issues as well. It can actually indicate that. So when a man is having issues with erectile per se, the man is actually having fertility issues. If you've gone for sperm count, the medical aspect of it, you can actually indicate that this person has fertility issues. So if you're having some medical signs that have to do with abnormal motility, sperm motility, it's having issues when you ejaculate, you're having poor ejaculation, the volumes of the sperm cells you're bringing out, the fluids you're bringing out is poor, it indicates fertility issues. So you have to, that is the medical signs you're getting at this point. So these are the things that awaits you, fertility issues. So you have to run to the hospital and be able to address this once you're having those signs. All right, so the physical aspect of it is what I explained. Physical signs of it is what I explained, as pain or swelling under the testes. So if you're having any pain, inflammations on your testes, this indicates fertility issues physically. So difficulty urinating is among the physical signs as well that you're having. If you're having erectile dysfunction, which you're seeing with your eyes, this is another part that indicates that you are having issues with fertility. I believe you're understanding me. All right, the lifestyle changes that equally affects you. When you're having a lifestyle of smoking and drinking excessively, uncontrollable, most times it affects your fertility. So it's a game that you can actually observe at whenever you need to conceive or whenever you have to get married. So once your lifestyle goes in line with smoking excessively, drinking alcohol excessively, having poor diet, having poor exercise measures, all those things indicate that you're going to have fertility issues later. When you're having high stress level, when your stress level is uncontrollable, that you're stressing up and down with the kind of job you're doing, is an indicator that issues of fertility will be knocking soon. All right, other lifestyles that can actually affect someone is the family issues of infertility, previous surgeries that someone has had. Age could actually be a problem when we talk about fertility. Then what do we do when you're having that? I said something about the family. If your family has the issues of delay pregnancy, issues of delay conception, and the rest of it, know that it's possible that you have that. Sometimes I explain it that because we are having poor diets, we're having a deficiency in our diet, the vitamins and trace elements we're supposed to be getting from our meals are not there, because we are being trained in eating swallows and the rest of it, swallowing different soup without inculcating vitamins, fruits into our system that enzymatic activity will take up. So once you're not doing that, just know that as a family issue has been going on generation to generation, delay in conception, that you're not running off from it, so you are still in line. So know that that awaits you, and in so doing, you'll be able to consult your healthcare workers to be able to address your issue now before it's late, before it start bringing mental issues for you. So I believe with this you understand. And again, previous surgeries that you've actually had or injury can actually sometimes affect your fertility. Those surgery can actually induce some problems into your system, or some hormones delay in production and the rest of it. Again, age, the women's age decline, as the women age can actually decline, especially at the age of 35. Once it's declined, once the fertility hormones are declining because of the age, you don't know that it can actually affect your fertility. Do you understand? So what do? You have to consult your health care providers. You can consult your doctor. You can go to scientists that do lab for you and be able to identify what the problems are and then give you solutions as well. On that note, you'll be able to address whatever issues that is underlying that is going to affect you. So just know so much that this information is for you to help yourself, help your friends, and help your family. So do well to subscribe to this very channel, because we'll continue to make you take in charge of your health. Thank you, and remain blessed.